works. So in today's topic, we'll discuss about micronutrient malnutrition. Those who have the textbook, it's page number 388. Page number 388. So micronutrient. Micronutrients or functional foods, okay, are elements required by humans in very small quantity. Okay, and these fight diseases and they also supply antioxidants. Any food that is rich in micronutrients, automatically they are rich in antioxidants as well. Okay. Iron, cobalt, chromium, iodine, copper, zinc, molybdenum. Okay, they all are some of the examples of micronutrients. Previously, micronutrients were regarded as those whoever has RDA less than 100 mg per day. But right now, vitamins and minerals are required in small quantities, even in microgram or milligram. They are also included under this. Deficiency of any of the nutrients, any of these micronutrients can affect a child's growth and development as well. Types of micronutrients you can see here. Water soluble vitamins, fat soluble vitamins, that you basically know that water soluble vitamins are vitamin C, vitamin B. Fat soluble ones are vitamin A, vitamin D, E, and K. And when it comes to minerals, macro and trace minerals or micro minerals, okay. Macro minerals like calcium, phosphorus, magnesium, sodium, which you require in large quantities on a daily basis. Trace minerals like iron, zinc, copper, iodine, selenium, manganese, okay. You require them in very minute quantities, but you require them on a daily basis, okay. This is the classification of, four major classification of micronutrients. And they are considered as magic bullets by many clinicians and patients as well, because these are the items that promote brain growth and function. They are also called as smart nutrients. There are 11 major elements that the body requires in form of macros and micros. Those are put on the slide. The examples are put on the slide. And it is through the rainbow revolution. What is rainbow revolution? It includes various changes that have come in agriculture, fertilizer industry, animal husbandry, horticulture. Okay, so all these revolutions, all those different segments in which some revolutionary programs or shift or laws have been made, okay, just to increase the nutritional status of the population. All these laws, programs combined together, we call them as a rainbow revolution. Like white revolution, it was like the milk society, corporate milk society, cooperative milk society was formed, okay, which from like Amul, okay, that led to white revolution. Green revolution in agriculture, so more impact on food grains production, cereal production was seen in India. Blue revolution is all the fisheries, laws based on fisheries that are implemented. Okay, yellow revolution is oil seeds. Okay, golden revolution is fruits and apple. Bioengineered apple or whatever, whichever regions of India naturally can sustain a good apple agriculture, promote them more, help the farmers in promoting the apple agriculture. Black revolution is petroleum based, anything petroleum based. Silver revolution, egg, and red revolution, potato, meat, tomato, And green revolution is all the fertilizers, pesticides used. Pink revolution is prawns, shrimp, okay. And brown revolution is leather. So these are the different revolutions which aims, the main aim of this rainbow revolution is to make sure of the availability. The country is producing the different nutrients and also consuming it as well. Green, yellow, orange, red, okay, vegetables, fruits. So more and more micronutrient will be reaching the population. This is the main aim of rainbow revolution. So importance of micronutrients in human health. Majorly, we talk about iodine, vitamin A, vitamin D, zinc, folate, and iron. Okay. So even in the World Summit of for Children's Health in 1990, that time, vitamin A, iron, and iodine was on focus. But as time went on, okay, more addition in even after the anemia prophylaxis program and universal iodization of salt, after that, the shift was over folic acid. Folic acid also gained momentum, and then along with that, focus on calcium, zinc, vitamin B, vitamin D, copper, and so on. One by one, focus on all these vitamins and minerals also gained momentum. Earlier, it was just iodine, vitamin A, and iron until the 90s. In 2000s and the late 2010s, all these vitamins and minerals also gained that focus. Certain micronutrients like vitamin A, D, zinc, they are well recognized. Subtle deficiencies are difficult to make out immediately or clinically. So, and some deficiencies do not have any specific features at all, okay, like zinc deficiency and all. So, serum estimation of micronutrient is costly, and it is not, since it is not freely available, we require a lot of programs, nutritional programs, to make sure we can plug away the deficiencies from the population. Then hidden hunger, or it is also called as subclinical micronutrient malnutrition. So it is defined as deficiencies in essential micronutrients like vitamins and minerals in individuals or the entire population, which will definitely have a negative impact on health, cognition, function, survival, and even economic development of that region. Okay, so that is hidden hunger. Malnutrition worldwide, it is claiming over 6 million lives. Okay, and out of that, under 5 children are majorly affected by malnutrition. And also, malnutrition will also lead to severe growth and mental retardation, lower IQ points. Like, for example, vitamin A deficiency will lead to blindness, folic acid deficiency will lead to cleft lip, neural tube defects in the child. Vitamin D and calcium deficiency will lead to poor bone formation. Okay, these are the different forms of hidden hunger that overtly will have some clinical features on the growing child as well. In India, malnourishment, 35% of developing world's children are malnourished. Vitamin A deficiency, largest number of vitamin A deficient children in the world is in India. Only 43% of children between the age of 6 months and 59 months are malnourished, are vitamin A deficient. And only 43% of them receive the doses for vitamin A prophylaxis as well. Remaining percent, 57%, remaining 57% of the children are not even getting this prophylaxis. Less than half of the Indian children who are vitamin A deficient are getting the vitamin A prophylaxis. When it comes to iron deficiency, 75% of children are already deficient in iron, and 51% is deficient in 51% of women in India are iron deficient, are anemic. Iodine deficiency, all the goiter belt or iodine deficiency belt in India, like the hilly regions, pick any state or union territory, and if they have a hilly region, mountainous ranges, mountain ranges or hill ranges, definitely the people population living there comes under the goiter belt. Okay. And there is no way to obtain iodine from the diet. The only way is fortification. Only by the use of iodine fortified salt, you can get the correct dosage of iodine. And only 50% of Indian households have access to adequately iodized salt. Zinc deficiency, it will lead to stunting in children. 42% of children, if they are suffering from stunting, most commonly it is because of calcium and protein and zinc deficiency. Even a study that was conducted in a hospital, SAT hospital, Trivandrum, uh, on the umbilical cord blood micronutrient levels among all the children who are low birth weight versus normal weight, preterm versus small for gestational age. In that data, it was shown that micronutrient levels were lowest in preterm babies. Okay, and then the second rank goes to small for gestational age babies. But in both group, micronutrient levels were very less. Okay. So it means it gives us the data, it gives us a conclusion that if the mother is like not healthy or the mother is not taking the proper supplementation of micronutrients, usually it will lead to preterm or small for gestational age babies. Even complementary feeding, after when the child is on breastfeeding and on top of that formula feeding or complementary feeding if it is initiated, okay, breast milk supply will go down and the child will not be well adequately, will not have the adequate nutrition. Coming to different micronutrient deficiency disorders, in detail we will discuss about iron, vitamin A, iodine, and folic acid or folate deficiencies here. First, iodine deficiency, or sorry, iron deficiency is the most common micronutrient deficiency throughout the world. And WHO, World Health Organization, has a grading system for anemia. The same table is given on your textbook as well. Page number 391, table 30.1. Okay. So population with respect to their age. Okay. If a child, of an infant between 6 to 59 months of age. Okay. Infant to toddler age. Their hemoglobin level, if it is more than or equal to 11 microgram per deciliter, okay, hemoglobin level, if it is 11 or more than 11, the child is not anemic, okay, but if it falls below 11, 10, 10.9, okay, 7 and all, it means the child is anemic. 5 to 6 years of age, again, 11.5, more than 11.5. In children, in pregnant women, and then in children, all genders, teenagers, and non-pregnant women, the hemoglobin level should be equal to or more than 12. If it is less than it, you have the grading system. If it is less than 11, between 11 and 11.9, mild anemia. 8 to 10.9, moderate anemia. If it is less than 8, severe anemia. In pregnant women, if the hemoglobin level is less than or equal to or more than 11, normal. But if it falls below that, falls below 11, it means pregnant woman is anemic. In men, should have the highest amount of hemoglobin. Should be, they have to maintain a hemoglobin level more than 13. This is the grading system of anemia. Adolescent girls and boys after the age of 14, you have to use the same data as non-pregnant women and men, respectively. So we have a lot of programs as well in India, like Anemia Mukt Bharat. Okay, under that, when a lady is giving birth to the child and when the umbilical cord is cut, okay, between the mother and the child, there is a delay. Okay, the gynecologist, the obstetrician will delay the cord cutting, cord clamping for 1 to 3 minutes to make sure that maximum of the blood is available for the child. Okay, maximum blood passes from the umbilical cord to the child. Okay, so the child can sustain with that blood for a longer period of time. So umbilical cord, soon after the labor, will be delayed. The cutting of the cord will be delayed by 1 to 2 minutes. Okay, this is also advised under the program of Anemia Mukt Bharat. Cooking in iron pots can also improve your iron availability. Drinking lime juice or any citrus fruit juice while you're taking some iron supplements, or if you're taking some a good iron rich meal, and if you're putting a lime juice on it, or having a lime juice or lime soda or citrus fruit juice along with it, it will enhance iron absorption. But if you're having coffee, tea, along with iron rich supplements, it will not allow good absorption. And according from UNICEF's point of view, weekly iron tablets should be given to adolescent girls and also boys. Okay, both girls, adolescent, teenage girls, and boys should be supplied with iron tablets at school. Okay, to prevent anemia. Weekly iron folic acid supplementation program, WIFS, that is the name of it. It is now integrated with primary healthcare services and school health program. So weekly, every girl child, adolescent girl child, and boys will get their folic acid and iron supplements. And daily folic acid and iron supplement is advised in pregnancy and lactation. Next, coming to vitamin A deficiency, that is now declining. Okay, vitamin A status is improving in the population as compared to previous years. But there are some areas in India, some backward pockets of villages and community in India where still it is prevalent. Okay. Some pregnant women will also complain of night blindness, etc. So it is still prevalent. So vitamin A prophylaxis program was started in 1977, and now they have combined it with universal immunization program. Okay, so as a part of immunization for the children who are till the age of 5, and pregnant women should get the vitamin A prophylaxis twice a year. And these are the signs and symptoms of vitamin A deficiency. You will have severely dry skin, dry eyes, night blindness, fertility issues, and trouble in conceiving, both in men and women, poor wound healing, acne, breakouts, delayed growth, stunted growth, mental retardation, growth retardation, frequent infections. Okay, so these are the signs of vitamin A deficiency. You can do a you can rule out a vitamin A deficiency by doing some serum retinol level blood test, conjunctival impression cytology. A tissue paper will be placed minutely in your conjunctiva to absorb the tears, and the tears will be studied under microscope. These are the tests available. Pupillary reflex test is also done. So this is the vitamin A prophylaxis program. So vitamin A syrup in a pre-calibrated scoop is given. It's a spoon. Okay. So syrup comes with a spoon, and if you give one whole a spoon, you are giving around 2 lakh international units. So for example, if you are giving 2 ml, 2 lakh international unit. If you're giving just 1 ml or half a spoon, it means you're giving just 1 lakh international units of vitamin A. So a nurse, based on the child's age, the nurse will decide how much dose should be given. Okay, if the child is an infant, okay, from 6 months to 12 months before the first birthday, okay, before first birthday, from 6 months to 12 months, that 6 months time period. At the sixth month, the one ml will be given. On the first birthday also, on the first birthday onwards, 2 ml will be given. Okay, and if the child is less than 6 months of age, just a infant, newborn to infancy, early stage of infancy, just 50,000 international units should be given. That is less than half a spoon. Okay. And after 1 year of age, up till fifth birthday, okay, up till the fifth birthday of the child, first birthday till the fifth birthday of the child, 2 times a year, okay, 2 ml of vitamin A syrup should be given. This is a part of an immunization program. And then after that, you don't have to give the syrup until there is a fever deficiency. Next comes to, if a woman gets pregnant after giving birth, within that 42 days after giving birth, 2 lakh international units of vitamin A should be given to the woman. This is the program. Next, come to iodine deficiency. When a fetus is growing in a mother's womb, iodine is a very critical nutrient because it helps in the growth of nervous system, central nervous system. Okay, and if while during the pregnancy, if the mother is deficient in iodine, that could lead to mental retardation. A child who is born with mental retardation, okay, or goiter. So in the fetal stage, if the mother's diet is deficient in iodine, it could lead to abortions, stillbirth. Stillbirth means a child is born lifeless. Congenital abnormalities or anomalies, increased perinatal mortality after birth. The chances of the child, newborn baby, surviving after birth, okay, that is less. Increased infant mortality after the newborn period, 28 days. The survival rate of the child will also come down. Cretinism in detail, the types, there are two different types of cretinism. We have discussed that in the iodine chapter in nutrition science. You can go back and check that recording. Neurological symptoms, low IQ, myxedematous cretinism, that is another form of cretinism that is very common in adults as well. Okay. The neonates, the first 28 days after birth, okay, the child can have goiter or the child can have hypothyroidism. Then coming to children, teenagers and adult, okay, iodine deficiency again would lead to goiter, hypothyroidism. Hypothyroidism is very common, and impaired mental function, iodine induced hyperthyroidism. That happens after over administering iodine supplements. Okay, hyperthyroidism can take place. So goiter also, when we talk about, this is the spectrum of iodine deficiency disorder. Earlier, we used to consider only goiter as a deficiency disorder for iodine, but now it has changed. Now we call it as an iodine deficiency disorder spectrum. So all these diseases that you see on this slide, they all come under the spectrum of iodine deficiency. Next, you have universal salt iodization. So in 1983, in India, the government of India took the policy to iodize all the salt that is manufactured at an industrial level for human consumption and also for the cattle consumption as well. Okay. So this is what we call as universal salt iodization, not just in India, all over the world. Okay. Salt iodization is adopted because salt is a universal food. Okay. And it is used in the same quantities everywhere. The quantity of salt used in day-to-day diet is same everywhere. Okay. So private sector was also permitted and encouraged to produce iodized salt. And that's why we have Tata iodized salt, Sampurna iodized salt. There are different brands of iodized salt because now private sector was also encouraged to make salt and iodize it, fortify it with iodine and sell it. Okay. And this, the major, those days in 1983 and all, 1980s, the main target was to eliminate goiter. Okay, was included in the Prime Minister's 20-point National Development Program as well to remove goiter once and all for from India. Okay, so universal iodization helps in that. So 30 to 50 parts per million potassium iodide is fortified in the salt. Salt testing kits are also available with which you can understand is it too much iodine or less iodine. Double fortified salt is also available. Double fortified means not just iodine but also iron. Iodine and iron fortified salt is also available. Then folic acid and folate. So RBC, red blood cell maturation, is what gets affected when you are deficient in folic acid or folate. But if a woman is pregnant and if she is getting deficient, she is deficient in folic acid or folate, she will have usually 90% of cases, she will have a child who will be born with some neural tube defects. Okay. So the deficiency of folic acid usually leads to megaloblastic anemia. So current iron and folic acid deficiency leads to, if the person is deficient not just in folic acid but also iron. Okay, both these mineral, if a person is micronutrient, if a person is deficient in, they will develop dimorphic anemia. Okay, so dimorphic means RBCs will be of big size than normal, big sized RBC. Okay, large sized RBC, and but the RBC will not have enough color to it. Okay, will not be bright. So bigger in size and lighter in color. So dimorphic RBC, red blood cells, are seen in the person who has dimorphic anemia. Okay, and usually it can happen due to hookworm infestation also. So hookworm infestation very common in children. So you have to deworm the child, or you have to make sure that the tapeworm or hookworm, okay, these are taken care of. Anti-helminthics is prescribed. Okay, and the child is freed out of worm infestation, and then you start giving the vitamin B12, folic acid, and iron supplements. Okay. So first you have to deworm the child and then start the supplements. And also after blood transfusion also, if somebody has undergone blood transfusion, that also could lead to dimorphic anemia. 4 mg per day of folic acid is advised. Then micronutrient interactions, which means micronutrient interactions, which means every nutrient that you take in a same meal, it interacts with each other in some or the other way. Okay. So these interactions can affect the bioavailability of other nutrients, like how calcium and iron, if taken together, if you are having more than 300 mg of calcium in a meal and you are having an iron rich meal, they will conflict, they will not allow each other's absorption. Okay, so that is one example of interaction. Either it could be positive or negative. If you're taking vitamin C and iron together, it's a positive interaction, they both will help in each other's absorption. If you're taking calcium and iron together, it's a negative interaction. Okay, so copper and zinc, negative interaction. Iron and folic acid, positive interaction. Okay. So it may either enhance or inhibit the nutrition absorption or utilization. And very high or very low levels of one or more nutrients can also affect the bioavailability of other nutrients. As I have mentioned, if you're having a meal in which more than 300 mg of calcium is present, definitely that's a high amount of calcium in a meal. It will definitely hinder, not allow the intestine to absorb iron. Okay. If the calcium was below 300 mg, it will not cause much trouble. Okay. So interaction can affect all major categories of nutrients, okay, not just micronutrients, protein, carbohydrates, fat, vitamins, minerals, okay. These can also get affected by this nutritional interaction. And sometimes nutrition interaction with non-nutrient components of the food can also alter your availability, okay. Like for example, fiber and all. Then you have UNIMAP, which stands for United Nations International Multiple Micronutrient Antenatal Preparation, UNIMAP, United Nations International Multiple Micronutrient Antenatal Preparation. So this is for pregnant women. Antenatal means during pregnancy. Multiple nutrient means not just one, but lot many nutrients are together. And United Nations are funding the spread of this, okay, to give it free of cost for all antenatal women, pregnant women, okay. And this is how the label looks like. Every country has the right to use this label and send this to their primary healthcare centers, public healthcare centers, and help women maintain a good nutrition, do not be deficient, and thus give birth to healthy children. Okay. So if it is visible, you can see here this multiple micronutrient supplement has vitamin A. Okay. 62% of the recommended uh, value on a daily basis is available, 800 microgram. Vitamin C is also available, 70 mg. During pregnancy, the requirement is around 115 mg. Then vitamin C, 70 mg you will get, that is 58%. Okay. The woman just have to have 2 more fruits, but remaining part of the vitamin C you're getting from this supplement. Okay. Because 115 mg is the dosage a woman should have during pregnancy. Vitamin C. Vitamin D, 33%. Okay. Remaining she can drink milk or vitamin D rich products she can have. Vitamin E, vitamin B1, B2, B3, B6. Folate is also available. Vitamin B12 is also available. Majority of the vitamins are available. Iron, iodine, zinc, selenium, copper. Okay, these all are available. And other micronutrients, other ingredients used here, you can see here some fiber like cellulose. Some fiber is also used, phosphate, sodium, magnesium, sucrose. Okay, so only one tablet on a daily basis, orally, they have to take. You have to store this tablets, this box. It comes in a bottle. Okay. Selenium, copper. Okay, these are the 180 tablets are available. So for 6 months, you can use this multiple micro supplement for pregnant women. And it can be made in any country. Okay, you can use this label, whichever country is using, they can put their name, but the content should be same. So that's all for today. Thank you. If you have any queries, please mention in the chat box.